Welcome to Starkey Soundbites. I'm your host, Dave Fabry, Starkey's Chief Hearing Health Officer. Now, May, in addition to being Better Hearing Month, is also Military Appreciation Month. So it's ideal here at Starkey, where we are very aware of the importance of the veteran population, who in many cases have sacrificed their hearing in exchange for their serving their country. And Starkey it's really important to us that we serve the military population for their service to this country. And we also know that two of the top concerns for veterans are hearing loss and tinnitus. And then right behind that actually are a number of factors that also affect balance. And so really when we consider hearing, tinnitus, and balance, there are three concerns that are very near and dear to the different veteran populations across the multi-generation of veterans that we serve. And so today I'm really delighted to have Dr. Alisa McKay. And I'm really glad that you could set some time to talk a little bit about Military Appreciation Month. Welcome.
Thank you. Thank you for having me.
It's great. And I'd love it if we were around the same table, but we're remote. And that just always makes it a little more interesting when we're trading time. But don't worry if we talk over each other a little bit. It means that we're engaged in natural conversation. So let's start first and talk a little bit about your background in serving the veteran population, and tell us a little bit about where you've worked, maybe your background, what drew you to audiology to begin with. I
came into audiology as a full-grown adult. After I had children and everything, so I decided to go back to school. So that was my story. After I went through grad school, I did my 4th year at the Salt Lake VA, and I absolutely loved it there. I loved working with the veterans. I loved that population. And it's a great place to work. It's very, very busy. It's challenging. It's a lot of fun, but I learned a lot while I was there. And so that was a great opportunity for me to be there.
Well, and following up on that, so when you began that, and you said it was the 4th year at Salt Lake City?
Yes. Yep.
And you said, how much you immediately fell in love with it. What really drew you to serve veterans through audiology?
I think the first thing that drew me was kind of the system of the VA. I felt like it was a safe place to practice. It was, especially to start out with, it was like, I knew what to expect when I came into work. And like when I left work, I was going to leave it there. So I felt like it was really predictable. And I think that's kind of what drew me to it. But then when I got there and I worked with the veterans, then it was a whole different thing, because you can't not work with a veteran and not love them. I mean, It's just a population that you just fall in love with. They're just so appreciative of what we do and so grateful for the services that we provide. And it's just such a great experience.
Fantastic. Well, and I also, in the process of my training in the previous millennium, when a master's degree was the first professional degree, did an externship at the Minneapolis VA. And I thoroughly enjoyed it as well. And then right after I got my PhD, I worked for 2 years at Walter Reed Army Medical Center in a research capacity, but also worked with a lot of active duty and military. And I would be remiss as we kick this discussion off with Military Appreciation Month, to thank anyone who's listening to the podcast today, whether you're a professional or an end user. Thank you for your service and dedication and service to our country. So, Alisa, any memorable patients that stood out to you during the time that you were working in the VA?
I have one that it's always those difficult patients that you work with that you're like, I am going to win them over. I'm going to solve this problem. Sometimes you win them and you feel like, that you can provide them the hearing aids, and that's what it is. And sometimes it's a matter of counseling. But there's one in particular where I worked with him and worked with him and worked with him. And by that point, at the end of all of that, I mean, we were friends. So that's the type of relationship that you can build while you're in the VA. And so
and a lot of times people assume that there's not the continuity that you would get in a private practice, but I do believe, having worked at Walter Reed myself, it is possible to have that continuity of care and continue to work with the same patients. I know it's challenging sometimes with the volume of patients that VA audiologists see. Is just from a clinical efficiency standpoint, the patients may get in faster on someone else's schedule, but I really enjoyed the opportunity to get to know many of the patients that I saw between the Minneapolis VA and at Walter Reed, where I did see them again and again, and that's a rewarding aspect too. And also, to your comment, Alisa, that it's oftentimes those reluctant patients that become your biggest advocates and really, talk to others about the benefits of amplification, or of also just listening. I'm a big believer that we have to listen with our two ears and one mouth, as Epictetus said, so we can hear twice as much as we speak. Can you comment a little bit on what some of the unique elements or aspects of hearing loss in the veteran population from a clinical standpoint, maybe as opposed to in non-veteran populations?
Yeah, I think it's a more complex patient that you're dealing with, medically, socially complex. I feel like the audiogram, the patients are going to have much more precipitously sloping audiograms because of the noise exposure. A lot of the times, the audiograms, they're going to have much more severe hearing losses than what you would probably see in the private sector. So you're dealing with greater hearing losses than you would in the private sector more often. So like you'd obviously see severe hearing losses in the private sector, but the amount that you see within the VA is going to be at a higher rate. And then, you're adding in those medical complexities because, there's mental health issues, there's PTSD, there's traumatic brain injuries, there can be hidden hearing loss, there can be APD situations because of those TBIs. There's so many things that can fall into it that makes it just a complex situation. So.
Yeah, you brought up the TBI and the overblast pressure that occurs from IED exposure, and I think that for me also highlights some of the differences when you're dealing with those Korean War veteran populations. It's mostly, some very powerful weapons, but mostly machine guns and rifles and things. You got into the Middle Eastern conflicts, and it's a lot more IED exposure and overblast pressure, traumatic brain, as you mentioned, PTSD hitting Korean War and certainly Vietnam War era veterans, where auditory exposure and how that can impact overall mental health issues has been a huge concern and opportunity for working with the technology to try to address some of these issues. And then I think, moving forward, as you said, like with vestibular issues, also with overblast exposure, that can also really impact mobility and certainly, unfortunately, as we've seen, again, people with damaged or missing limbs can also impact balance beyond that link that we know exists in the civilian population between untreated hearing loss and balance. So a number of important factors that is so intriguing about the multi-generational veteran population and why there is such a great need for great practitioners in the VA. What drew you to make the change from clinical practice into coming into your current role? And how long have you been with Starkey? Talk a little bit about that.
So I started just 4 months ago at Starkey. So this is a recent change for me, but I've been loving it. The things that I can change at the VA are, my scope of change is a lot smaller at the VA, but then when I made the move to Starkey, the scope of the things that I can change became much larger. So the things that I love to do is find problems, solve them, and fix them. So that's why I became an audiologist, because like it's easier to do that as an audiologist. So in the VA, the scope of practice for that was just within my small VA, but now I'm able to take that and I'm able to help a lot of clinicians and a lot of clinics instead of just the one clinic that I was at.
And also, you spent time working in VA hospitals, helps you understand. I mean, there's a saying, when you've seen one VA hospital, you've seen one VA hospital, because there are unique challenges and opportunities presented and provided at every location. And I think the biggest task for each of the people working out in the field or on the phones is just truly understanding the unique challenges and opportunities presented at each facility in your territories that you cover. And so, Alisa, you mentioned, one of the audiometric and audiologic differences that you see is, in many cases, in particular the high frequencies, but also depending upon the nature and how their hearing loss was caused, they may have greater hearing loss than what we often see in the civilian population, notwithstanding, yes, there's people with different degrees of hearing loss everywhere. But I think also a big challenge is that typical noise-induced kind of ski slope loss. And the veteran population has, black roots on their ski sloping loss, in the sense that it's very, very steep and presents technical challenges in many cases. I mean, it's not essential, I think, that you need to be an audiologist or a dispenser, but it brings a unique perspective that you have from working with the veteran population. And what about Starkey technology really helped factor into your decision to come and work with us as opposed to somewhere else in the industry? What features do you find are of greatest benefit to the veterans?
Well, when I first started at the VA, I slowly became aware of Starkey and I slowly became introduced to them. And I was like, okay, this is interesting. And then Genesis came out when interest was really peaked in Starkey, because that's a lot different from what Starkey was introduced, seen, or offering before. So I started fitting some of my patients that had, some of those precipitous losses where they were really normal in the lows, but then they just dropped off, because those patients can be difficult because they can hear the hearing aids work. And so you want a hearing aid that has a low noise floor, so that you can, so that it still sounds normal in those frequencies, but then you're able to amplify where they need it. And that's a unique challenge. And so I had a lot of success with those patients. So I was like, okay, I love this. So there was one check mark. So I was like, yay, great. This is awesome. So then I was like, okay, well, now let's try it on my tinnitus patients. So then I was like, there's another one that I love. Like, this is perfect. I love this. And then I just started like slowly moving and trying them on my different patients, different categories. I was like, let's kind of methodically like trying it on each different type as I worked through it, and being like, yes, this is great. So I really started to love Starkey and find that they were checking all my boxes for my patients. And that was what really drew me to Starkey, is just how much they helped our patients.
Yeah, you hit on a couple features that are really important, and that is that in addition to when you have that good hearing thresholds in the low frequencies and then the precipitous drop, you need a great feedback canceller. And fortunately, we've had an excellent feedback canceller system, so that you can fit with large vents get a little wonky for a minute, but these are mostly professionals listening, to be able to give them natural sound quality for their own voice while not whistling, in order to achieve audibility in those high frequencies. And that's the hard part. And then I would say with tinnitus, it is something that I think people are looking for an Ozempic kind of treatment, both for hearing loss and especially for tinnitus, because there are more veterans with tinnitus issues than there are with hearing loss. And it is often, the ears cry for help when it's being damaged, is it starts ringing and then never stops. But how, either from your clinical experience or in your role now, how do you counsel end users or professionals regarding tinnitus where there isn't a cure yet for tinnitus? Hopefully, we'll see someone in your lifetimes, probably not mine. I hope so, but he's trying to set that expectation.
We have things to offer them now. We have the hearing aids. We have, all the tinnitus programs that we have. And so there's so many things that we can try that there is a lot of hope. And I think that's the biggest thing that we can offer our patients is just hope that we have something for them. We have something that they can try, and we're there with them to work through it, and that there is hope to get through it. And so I think that's the most important thing.
Yeah, and I think the veterans appreciate, because in many cases they've had tinnitus for a long time. Sometimes people haven't addressed it before, as you said, and I think we've added some different types of noise stimuli and audiogram shape stimuli and a greater array of choices from pink noise, white noise, et cetera, that may be used. I think one of the critical things is to allow for modulation, regardless of whether it's a tonal or a noise-based tinnitus masker that can be shaped to the patient's loss, or the nature of, fine-tuned specifically to mask their tinnitus without being disruptive to other sounds. But that modulation is so critical, and I'm really glad that we offer both the professional or even the end user to vary the rate of modulation and to vary their tinnitus stimulus, because we aren't machines, and that will vary a little bit from day to day, and having that flexibility within our system. But also, I think so often we're looking for an algorithm or a device to solve everything, but a lot of the masking and the relief from that tinnitus is done at the brain level too. Now, sometimes it's the origin may be because of a traumatic brain injury or PTSD triggering something, but if it's peripheral, that's masking is doing its job, but so much is tied up in the cognitive behavioral aspect of this plus the device. And I really think we've upped our game in recent years with that, providing a greater array of noise stimuli, but then also thinking about it's not just the device that's doing this, it's the role of the professional to counsel, and also the role of cognitive behavioral therapy in combination with the devices that still, I think, yields the best results today. And to that, we're running close to the end of our time. And one thing I want to point out, we've seen in the commercial market from Market Track, the latest Market Track survey shows that it appears as though the stigma related to hearing loss and hearing aids is going down. I like to say, as an egocentric baby boomer, it's because of my generation now saying I'm not as stigmatized, but I have higher expectations for what hearing aids can do. What about the military population? Now, are you seeing that men and women in the military and veteran population are less stigmatized than in the past, or do you not see that?
Yeah, I think sometimes you are always surprised with people that are going to be willing to wear hearing aids. Like, they'll be like, oh, they look like the type of person that you stereotype that you're going to be too vain to wear a hearing aid. And they're like, oh, I'm not vain. Oh, no, this is fine. This is great. Give me that black one. And you're like, oh, okay. Like, yes, let's wear that. Let's wear that black one. That's perfect. And so I just love that they're just so willing. Some of these younger people are just a lot faster to come in and get help as soon as they're noticing it instead of waiting. And so that's been awesome to see as well. I also think that there's a lot of people out there that are worried about their brain health and protecting their brain health. And that's also motivated a lot of people to come in and get their hearing checked and make sure that they're protecting them.
That's great. The day is long gone where people were only trying to match their skin tone or their hair color, and going with colors that stand out and can be seen. Many people are wearing things in or on their ears now, and I think that has been a big help as well to sort of destigmatizing the idea of hearing aids, and particularly with all of the functionality that our devices have. And you mentioned a number of the very important features, whether it relates to being able to shape the audiogram in our technology with DNN 360 on Omega AI, with Tinnitus solutions, and we've just scratched the surface. But really the whole point of this particular podcast is on Military Appreciation Month. And I guess I'd ask you for maybe some final comments about meaningful military appreciation, if there was a better understanding of what that means. What do you wish every American would better understand?
The biggest things that I quickly learned working at the VA is that the cost of war is high and it's long lasting. And we're seeing these veterans come in years and years and years after their military service with problems of being able to hear their loved ones, missing out on conversations, missing out on hearing their grandchildren talking to them, missing out on hearing their wife or their family members talk to them. And those are important moments that these people are missing. And it's due to their military service, things that they have sacrificed for us. And I am so grateful for these veterans and the things that they have sacrificed for us and for our country to serve. And I appreciate them and what they've done for us. So.
Well, I think we'll leave it there. Dr. Alisa McKay, thank you for sharing these insights today with us about your work supporting veterans and your role with Starkey now to help those serve those who serve. And, with Military Appreciation Month, our thoughts and prayers are those serving currently in the military, in active combat or in conflict around the world, for the veterans as well. Thank you, anyone who is listening, who has served. We're deeply appreciative this month and every month. For those of you who found this discussion useful, like and share it with your friends. Subscribe so you don't miss any future episodes. I look forward to bringing you additional episodes of Soundbites in the future. Take care.